great to be back here on Let's Talk About It. I think I was here last week. I think I missed the week before. That's right. I had COVID. That's why I missed the parade, Mark. Mark Scrivener, our fire chief, is here with me, and Susan Johnson will be joining us soon. Matt Rupar is behind the glass, and he's making sure that everything goes just right, according to Hoyle, as they used to say. Anyway, Fire Chief Mark Scrivener is here with me. Hasn't been on the show for quite a while.
Thank you for having me.
Time to have him on, and I was just talking to Mark before the show started about the Boombox Parade, which looked to me like it was a huge success this year, as it always is. Question is how huge. I think it was pretty huge. I was not there though. I tested positive for COVID on July 3rd. My physician prescribed, as he did before the one time I had at Paxlovid. I took that, and the second or third day after I started the regimen, I was feeling pretty good.
That's good. They're saying this particular round is tough.
Yeah. I felt awfully sick. I mean, I waited 2 days before I got tested, and I was very disappointed to find that I had it. At the same time, you want to know, and I had to be the one to contact Wayne and tell him I wouldn't be able to carry the banner, and he went, oh man, that's horrible. What are we gonna do? But other people at the station stepped in, and somehow the parade goes on. Nobody is indispensable, not even yours truly. Anyway, Susan will be joining us real soon, Susan Johnson, and it's great to have the chief on. And I've had the privilege for the past, I guess 1 year, just to again serve on the Willimantic Taxing District.
Has it been a year already?
It has been, because I got elected back. Well, it hasn't been a year yet, because I got elected back in November, and there's another. We're up for re-election. It's now a 2-year term, which I like, and we're up for re-election in the fall of 2025. And I don't know whether I'll run for re-election again. I keep saying every time there's an opportunity to run for election, I say I'm retired. I'm not doing it anymore. But it's hard. I get drawn back into it. It's this is a community that so many people step forward and serve the community in so many different ways. And I just, I have, and as Mark has, as Matt Rupar has, as Susan has, as so many other great people have. I mean, we, people that are going, not just, not just for work, but going beyond the pale, doing more than, more than the job requires if they have a job, and volunteering and spending a lot of time helping the town. That's what makes our town go. That's what makes it so great, because we are a town that welcomes everybody. And so that carries with it a responsibility. Anyway, Mark, you've been chief now. I guess you became temporary chief in 2010.
That's right.
And then 2 years later, in 2012, you became the permanent chief.
That's right.
So you've been serving now for 12 years. A dozen. Okay. It doesn't seem, well, I guess it seems like that long.
It goes fast.
Doesn't it go fast?
Yeah, it does.
It really flies by. But I know that you've been on before, and we've talked about your career plans that started when you were pretty young, about being a firefighter.
Well, you kind of look back, don't you, and you realize that things fell into place. Mom had driven me by the firehouse at one point here in Willimantic, and she says, I don't think she remembers the story anymore, but she says, hey, you said you were going to work there. I don't remember saying that, but when I was 18, I marched right down to my local volunteer firehouse and joined up, really I can't really explain why I did that. It just had to be done, and I did it. And immediately walking into the fire station, I knew that was for me. I knew from the sights and the smells and all that was going on that resonated with me. So, but I also wanted to serve in the military. I joined the Air Force. I was a firefighter, and then came back to my, I grew up in Hebron, and I was there for a bit after the Air Force, and then made my way here where I've been for 25 years now. Over 25 years.
I can remember when you first came here, you were very knowledgeable about fire service and firefighting for somebody who was just a rookie.
The Air Force did me well.
You were well prepared, right?
Yeah, the Air Force did me well.
I was amazed at how much you knew. I know you. There was you commented on there was a website that was managed by Tom Beardsley. I believe that was you. That was you had a handle, and you didn't use your name, but I thought I thought it had to be you.
Well, I remember making some comments back then. That seems almost prehistoric now, doesn't it? With all the social media and everything. But I can't vouch for whatever. I don't remember what my handle was,
but you were on there, and I know you put some comments on there, and I used to read all that stuff, and I learned a lot.
I was young and foolish in some instances,
well,
impetuous, and probably said some things that today I would, probably regret. But that was a long time ago.
I don't know. I'm here. This is Susan Johnson, and I was waiting to be introduced by my co-chair.
Well, we have to wait until we finish his paragraph.
Well, yeah, and I was waiting, and I thought, but I just wanted to say, I remember one of the first times you gave a speech over at the Wyndham Center Firehouse. And you mentioned Escape from Freedom, the book. And I said, wow, that's very impressive. So I don't know as though you would have actually ever said anything that would have been of concern.
That book probably is one of the more influential books in my life by Viktor Frankl, right?
Oh, yeah.
Right, yes. And I was thrilled to hear you say that because that's one of my favorite books. And, it's certainly something that comes to top of mind during these days today.
You guys probably think I don't know who Viktor Frankl was, but I do. He survived
Auschwitz.
Auschwitz, right? Yeah. And he wrote. I know. I used to get audio tapes about positive thinking, all that kind of stuff, and there was a lot of stuff by Viktor Frankl on those tapes.
He wrote about his experiences in the first half of the book, which was really, really difficult to read.
Right.
And then he wrote about his philosophy that he had developed in the camp in the second half of the book, and it's still relevant today. It still very much resonates with a lot of people today.
Yeah, well, it is important when you go through tough times. To have somebody like him to, remind you that tough times are usually don't. Yeah, sometimes they do, but usually they don't last. And you have to stay in there and just keep plugging away. And that's really what we're doing now. We had a personal tragedy that took place a couple of months ago, and we're keeping busy, and it's nothing we can do anything about. The question is how do you respond to it?
That's it right there.
And it's not going to be, I'll never be quite the same after that.
How could you be?
No, you can't.
Yeah.
But we are, we're Susan and I and Leslie and our whole family are handling it quite well, I think, and so far anyway. And we're keeping busy. And like I was just talking before you came in, Susan, about my service on the Willimantic Taxing District Board. I served on that board before, when I was automatically on it as a member of the town council, but now those people are all elected individually, and that's what prompted me kind of to run, because I figured I wouldn't have to, I wouldn't be serving on the town council and spend the town council. Yeah, serving on the town council is a lot. There's a lot of meetings and there's a lot of issues, and I thought that I was the one that actually was the one who initiated the charter provision that set up the taxing district as sort of a board of finance for the police and fire departments in Willimantic, and removed it from the Board of Finance.
Let me just say something about that, because
I wasn't finished, but that's okay.
Well, you had a pause in your remarks, so I thought I'd intervene at that point in time.
I have to breathe,
Yeah, that's what I'm waiting for. Have a nice deep breath now.
Go ahead.
But I just wanted to say, when I served on the Board of Selectmen before it was called the Town Council, we also oversaw the police fire as well for the local here in the Willimantic Service District. And so they had the separate board in the villages, the first taxing district.
Right.
And they oversee the volunteers, and they have, of course, the state police that they have. They don't really have much of an agreement with them because they're just providing services to that area. Some places, like some different towns, actually have a resident state trooper. And we have had that in the past, and I think we still might over at the Wyndham Heights. They have an office there, but I'm not sure what the hours are.
Not much based on what I learned took charter revision. Not much anymore.
Yeah, I keep looking at it to see what they have, but that is that makes it a more complicated town in terms of the finances, in terms of how we do things. It makes it much more complicated than, say, a town like Glastonbury that has all the services provided to the people in the whole town of Glastonbury, for example. All their services are provided.
They're a little wealthier than we are too.
Yes, well, there's that. But then there are towns like New London or Bridgeport,
Oh,
and those
sure.
are all town-wide police fire services places as well.
Yeah, I think Norwich has townwide police anyway. I don't know about fire service. We didn't look into that, but we had the mayor of Norwich up here last time we did charter revision, and I know they had townwide police. I don't think we got it. I don't know what they have for fire.
So they have a career fire department in the urban section, and then they have 5 volunteer fire departments surrounding them.
Sort of like us.
Yeah, and they don't have as good of a working relationship, I don't think.
With their volunteers.
I think our 4 departments here in town work pretty well together.
Yeah, it seemed to. I know we experienced the fire, and I'm sure you remember it, up on Leslie's house up on 125 Summit Street. It was the same year I had my cancer surgery. It was 2005, I believe. Six. That's right. 6. You're right. 2006. It's been.
It's etched indelibly in my brain.
Yeah, we remember it well. And
Whenever you see something like that in your own family, you really are taken aback, and it was certainly quite a shock to us.
But we also experienced how well the departments work together. I mean, I saw, I was town attorney in Mansfield at the time, and I saw Mansfield people there. I saw Wyndham's people from the Wyndhams. I of course saw people from Willimantic, and the house was saved, even though it was a real difficult.
It was in tough shape.
Yes, it was. It was difficult.
It was.
Difficult fire, because it was a Victorian with balloon style construction, and we were amazed because we got the call from Leslie right after they discovered the fire. We quickly got dressed, ran over there, and the firefighters were already attacking the fire.
Yes, they were there within 5 minutes.
We can't say enough about
No.
you're right. The cooperation of departments. That was, 18 years ago now, but that was indicative of the way it works. Go ahead, your turn.
We're so
She's pointing to herself.
we're so thankful though for the work of our local fire department people, and also for the region working together so well. I think that really shows that in Eastern Connecticut we do have a sense of community, and one of the things that brings people together with a sense of community is the fact you've got fire service and you've got police service that works together, and it really does give you that sense of security and community. It's very important.
Very, very true, Susan. And anyway, I was talking to Mark a little bit about he talked about his history of wanting to be a firefighter from an early age, and also the service in the military, which we've talked to him about before, and also that he's been chief since permanent chief since 2012. I just want to talk a little bit about I noticed about the strength of the department, and in terms of numbers. So you have a chief, obviously a deputy chief.
That's right.
And you have 32.
We have 4 shifts with 8.
Yeah.
4 shifts with 8 now. We had just last year switched or increased our staffing from 7 assigned to 8 assigned now per shift. So that's a big change. Call volume has been growing exponentially. We did over 5,200 calls last year, which is a huge number for us. We'll probably do that again this year. And I could just see that we were at capacity. We really were at maximum capacity for what our staff could do.
Stretched.
And we had to have some relief, and thankfully the town manager, the town council, or I kind of refer the board as the council, even though that's not the right terminology, but
enough.
It rolls off the tongue.
I know what you mean.
we appreciate that they saw that, and in the town manager, Jim, also has allowed us to hire in anticipation of attrition or retirement. So we've offered our staff a bonus, an exit bonus. If you give us a year's notice before you retire, you put it in writing that you're going to retire in a year, we'll give you an exit bonus. And that allows us to onboard somebody. It takes us sometimes 10, 12 months to onboard a person.
Yep.
We're trying to be more agile. We're trying to, hire faster. But even so, they go off to training, maybe in February or in August. They finish by either Christmas or by May, and then there's EMT school if they're not already in EMT, and then there's there's field training to be done that can take a while, and and then the person has to get nationally registered as an EMT. It takes time to onboard a new person and have them be a useful member of the department.
Right.
And so Jim has allowed us to hire in advance. So in the past, somebody would retire or quit, and then we had to kind of scramble and react, and then the next hiring cycle we'd get somebody on board. We've lost some time, and now we've got to school them, then we've lost some time. Meanwhile, all the rest of the folks are making up the difference, and we're wearing them out, especially with the call volume being what it is. So with us being able to hire in advance, it just rolls right into the new person when that person retires, reduces some of the wear and tear on the staff.
Yeah, I have a question because the call volume is increased. Could you tell us a little bit about what the nature of the calls are and why it's?
Well,
why you think it's
80% of our calls are medical.
Yes.
And that
Okay.
holds true. It slips 78%, but 80% of our calls are medical. And so that probably is driving the large part of it. Our fire volume in terms of non-medical calls has been relatively stable over the years. Small increases. It's the medical, which, it's secondary to all the things that go on in our society, right? The lack
Sure.
of access to quality health care for one reason or another. Half of our patients are over the age of 65. Another third of our patients are on Medicaid, meaning that they're very low income. All of the different societal issues that are related to those two things. Folks who are over 65, as you well know, not calling you out here, but
Right.
there's certain
You're talking
things.
about me, though,
There's
right?
certain things that come with age, right? And
I'm learning that. Yeah.
when we have an older community, then there's some
Yeah.
reliance on the ambulance for those services.
Yeah, more so for sure. And you also, just so our listeners are clear about it, for fire service, you pretty much, unless you're on call to go to another town, another district for to help out with what do they call it, mutual aid.
Yeah.
You would be you cover the city of the taxing district, the city taxing district, but for
ambulance,
villages.
ambulance you cover. Go ahead.
not only Wyndham, but the town of Chaplin as
Right.
well. We're doing about 50 square miles of ambulance coverage.
Right.
Yeah,
Yeah, and you've got the full town of Wyndham too.
we do. The full town of Wyndham
outside
and the town
of the
of
city,
Chaplin.
which is
yeah.
a lot of area.
So then there's also the idea that you have to have a response time within a certain period of time. So how is that being managed between the town of Wyndham and our
So for anybody who wants to know what our numbers are, if you look at the town of Wyndham, wyndhamct.gov website, and you go to agendas and minutes, we have a district meeting and every month, sometimes every 2 months, and on the agenda is always linked is my report to the board.
That's right.
And in my report are the response times broken down by district. So if that's a concern to you, it's there every 2 months at the latest.
It's
Well,
always looked very good to me. Before you
I'm
start
not
talking again.
I'm sure it is very good, but I just wanted the public to hear how good it is because that's one of the things that we take great pride in is that you have great response times in this region, and that doesn't necessarily always hold true in a rural area like this because we are considered in some areas we're considered as rural. So having a good response time like that is just something I wanted to point out as a point of excellence that we have here.
And in Willimantic, we can be anywhere in district, the 4.5 square mile district, in minutes.
Right.
In the non-Willimantic part of town, we have the volunteer fire departments who mobilize as well. And it might be your neighbor. So you get out of bed or you get off your lawnmower and you jump in your truck and you go to your neighbor's house and you start that care, you start that first aid while the ambulance is responding. So even though you are waiting for the ambulance to come from Willimantic, you probably have one of your neighbors starting first aid for you.
Mm-hmm. And one of the things, too, that we have here is Generations. And Generations is a federally qualified health center that does help people on a sliding scale. So there is good medical availability providers for people to be able to access help. And I just wondered in terms of is there some connection or some way that we need to make sure more people know about Generations for the sliding scale medical services? or because we do have a number of people here. I think that with the last I looked, about 40% of the people in the Willimantic-Windham area were on Medicaid. And so that's why we got a designation for Windham Hospital as the Medicare hospital, the only one in the entire state. And we got special grants Congressman Courtney brought here because of that designation, because this community is different than almost every other community in the state.
Generation certainly seems to be well used in this community, and it's probably I don't know what their census is, but I would suspect that they're approaching maximum capacity as well.
I think so.
And there may need to be some expansion there in the future. I have no idea what their strategic plan is, but it's well used resource in the community for sure. And I don't know what drives some of our patients to access ambulance. I don't know any one thing that drives our patients to access the ambulance rather than some sort of care at a place like Generations. But it is a factor that we face on a regular basis. When we have something egregious, when we have somebody who's requiring some interventions, we try to activate some resources like our Human Services Department, like Center for Healthy Aging at Windham Hospital, and some of the other resources in town to try to offer those folks some help. We can't force the help on them, so they have to willingly accept it.
Right.
But everything from hoarding to failure to thrive to elder abuse to whatever, we actively try to engage services for those folks. So the crew will come back from a call and they'll say, Chief, we saw some concerning things. We need to make a referral with this patient. And so I start making the phone calls. Angela over at Human Services is usually my first phone call.
She does
So
great
you have
work.
to
Absolutely.
provide coverage 24/7 with just the 4 divisions.
That's right. Yeah.
That's got to be somebody between you and the Deputy Chief Palmer. I would imagine that you and the other captains and lieutenants probably, because you have people that are off for certain reasons, for sickness or vacations and things like that. So it must be a real.
It is.
It must take time to set up the roster for each.
So we
shift.
the roster is we live and die by the roster.
Yeah.
And we have established what we call them hiring rules. We've come up with these policies and procedures for hiring that
Sure.
we've all collaborated together to create, and really the captains manage that. The deputy takes a very active role in overseeing that process.
Yeah.
I'm more at the strategic level where
Right.
I'm not dealing with the nuts and bolts. I'm dealing more with the higher level things.
Yeah,
So I'm
CEO.
very grateful to my shift commanders, the captains, and to the deputy for their ability to manage that without a great deal of intervention on my part.
Based on what I've read in the union contract, you have input into the promotions and stuff like that. You as the CEO, the chief of the department, you definitely want people to work with in that regard who are people that you are comfortable with. 'Cause they have to be good.
We start right off the bat when they walk in the door as a new employee, preparing them for a future promotion. And really, it's the first year is learning the job and all that sort of thing. But we still have an eye to the type of initiative they're taking in that first year, how they carry themselves, how they interact with the public, how they interact with their coworkers. And then a year in, maybe we're starting to offer them some early responsibilities. It's something small. For example, we have a cache of gas meters in the building that have to be functional all the time. If you have a carbon monoxide incident or a natural gas leak, and so somebody will be offered the opportunity to manage those, and they don't have to do it. It's not something we force. And we say to them, if you do this well, then we'll step you into something bigger. And that process continues for the first 5 or 6 or 7 years that you're there as we step you into greater and greater responsibility. By the time you sit for the first interview for a lieutenant, you ought to have either well demonstrated your ability to lead or not. And that should be very obvious in the interview process. We bring in other officers from other fire departments to do the interviews. And usually they're able to flesh that out real fast. Who's who's the natural leader or the developed leader and who's not.
Yeah, that's how it works in many fields of endeavor. But here we are dealing with public safety, and it's so vitally important that the people that are making the hard decisions at the top, deploying people and stuff like that, and what you do and Deputy Chief Palmer does, your captains and lieutenants, they got to be good.
We're always talking about and always preparing to develop our leaders. That's a daily topic.
And you do a great job at it. I just wanted to change the subject a teeny bit because
No.
one of the things that when I was on the council on the Board of Selectmen back in the day was and it's still an ongoing issue, is the housing code and building code inspections and how it's coordinated through the fire department and with the code officials. And I just wondered if there's referrals for things that may be dangerous or any of those kinds of things, because those are the things that might help with preventing fires in the future. And I didn't know how the town was
I think we're
coordinating that
doing
stuff.
a wonderful job at it as
good.
as a
Good
town.
to hear.
And for the public, there's a building code that's adopted by the state of Connecticut. There's a fire code that's adopted by the state of Connecticut. And the state of Connecticut creates an environment where the town can adopt a housing code, in which we've promulgated and adopted. And the building official, the fire marshal, the housing code director all work together. But we do make referrals from if we go to an ambulance call, and that's one of the soft benefits of having fire-based ambulances. You have qualified firefighters in somebody's apartment building, and they see a possible violation, they make the referral to the fire marshal, building official, or housing code, or all three. And I get those all the time. I'm constantly making those referrals. And Rich Cody told the council the other night that we probably are one of the leading communities in the Eastern Connecticut in terms of how we manage our housing code. He had said that to the council, the full council, the other night. And I believe that's true. I find that the housing code director, the building official, the fire marshal are very, very responsive to our referrals and are usually right on top of things when we make those referrals. And and we're not making frivolous referrals. We're saying, hey, there's life safety issues here. There's health issues here. There's things that need to be dealt with sooner than later, and they get right on top of them.
That's fabulous, and I was pretty sure that was the case. And one of the things that I worked at very hard when I was on the council, on the Board of Selectmen back then it was called, is to try and make sure the code enforcement was being done and coordinated with the town. And they had limited, the housing and building code officials in terms of the numbers of hours that they had to work. So it was a very difficult process back then. But I'm so thrilled to hear this coordination is going on now, and I presumed it probably was doing much better than it had been back in the late 80s, early 90s. So this is great. I think we're running down to having a commercial
I just
break.
wanted to point out that I can remember then when you were fighting so hard to increase the housing code officer to full time.
Yes.
And the housing code officer was half time, and she
Yes.
fought like crazy to. I remember that she'd come home and she'd be all upset because people didn't agree. The Board of Finance didn't agree. So you need a full time housing in an urban situation. The housing code is vitally important because there's so many people living in rental housing. Okay, and that's where it applies most of the time. And so Susan was successful, and I remember that now. Great job, Susan.
Thank you.
Thank you so
you.
much. And we've been talking to Mark. Everybody recognized Mark's voice. I'm sure you know that we've been talking to Fire Chief Mark Scrivener, and we'll be right back after these words from our wonderful sponsors.
Hey, welcome back, everyone. This is Susan Johnson. I'm here with my co-host Dennis O'Brien and our very special guest, Chief Scrivener, Chief of the Willimantic Fire Department, and we're so pleased to have him here. And we're learning all about what's going on at the fire department. And I just wanted to know, we have the dispatch center there too, and we have some new equipment. You want to tell us a little bit about that?
So during the break, Dennis was commenting on how the firehouse is kept neat and orderly, and it's a complete wreck right now because we have a dispatch center upgrade going on.
Yes.
So the dispatch center is temporarily located in the EOC, Emergency Operations Center. The kitchen has been gutted and is under renovation, so everything that normally lives in the kitchen and dining room area is spread out around the second floor. And we have 2 new ambulances in the building a building that didn't have enough space for apparatus before the two ambulances arrived. So we're constantly playing Jenga on the apparatus floor. So it is a bit of a wreck at the moment, but it's for all good reasons. The dispatch center is probably 95% finished. We have a short punch list of things that we need to do to get it in service. We're going to meet next week on Wednesday to kind of lock in the go live date, which will probably be the following week, Monday or Tuesday. And then the move over will happen in the course of a day or so back into the place that it belongs, and then the EOC will be vacated. The center looks great. It's just, tech. It's very high tech, and it seems like there's just all sorts of techie stuff that needs to get sorted out. That's way above my head, but we have people working on it.
That's great, and I just want to say how pleased I am to have been working with Senator Flexer and with your department and the council to make sure we were able to do the upgrade. And I was just really impressed with the type of upgrade, because you're talking about new technology, but you're also talking about being connected with the rest of the state.
We are very proud of the fact that we have what I call a hybrid regionalization approach, where our IT stuff, our computer-aided dispatch software, for example, lives in Tolland in their dispatch center. The back end lives there, but we use it here on the front end in Willimantic, and we have a collaboration. They have their own dispatch center. Tolland is a regional dispatch center, but rather than closing ours and migrating all of our radio communications to them, we still have a public-facing presence here in our building. But we share that. We have shared services, shared software, and taking it to the next level, we're migrating to the state's radio network, which the state police are already on. Many fire departments around the state has incentivized fire departments and emergency service organizations to migrate. It's not an easy migration. It's a lot of work, but we have to change all the radios and all the apparatus in town. We have to test to make sure we have coverage. There's lots of things that are going into that. It's not going to happen overnight, but we're in the early stages of that migration. And once we're on the state's radio network, which is fiber optic based, we can talk to anybody anywhere in the state who's on the network like they're standing next to us.
I think that'll really help at the legislative level, because you're going to have more interaction with each other, and you're going to have more discussion about the types of policies that maybe right now it's confined to a region or maybe even just a municipality. And to be able to communicate these things throughout the state will really help us understand what the needs are and how we can, proceed to make our policies more expansive for protection and making sure people are safe.
The state has encouraged, since 9/11 anyways, a more regional thinking. And we've had a couple train derailments that brought in resources from all over the state. We've had certainly the Willie Waste fire that brought in resources from a long ways away. And it would be helpful if everybody was on the state network and they could all just go to the same common frequency and operate, rather than having to try to piecemeal all the radio systems together. And I think, as we go into the future, it's going to be more real or more true that resources are limited, and that we need to be able to rely on regional resources farther away on the state of Connecticut.
Yeah,
And I have one more thing to ask about
still
that.
your turn?
You should see the look that
Still your
just
turn?
gave you.
This happens all the time.
Well, one more thing. I did want to. It's a follow-up. Excuse
usually
me.
lose these battles.
Into the into this regionalization. One of the things that when I was on the Board of Selectmen back in the day, we realized too that we were a regional hub for if anything happened in New London and Waterford and that area because of the nuclear power plant or any type of difficulty there. And of course, there's also the idea. Well, how are they going to get to Wyndham, for example, for protection if in fact there's an issue there, because the roadways just are not as wide as they might be for some type of an emergency. Could you just go into how this new system will actually facilitate perhaps a better regional response for people in that area?
Sure, and I want to point out, by the way, that we're now on the third alarm for Groton Sub Base. Mm-hmm. So if they have a fire in a sub, they'll probably go to a third alarm very quickly and draw Willimantic and Yukon into it. But with the state radio system, we transmit from the vehicle to the tower, which gets dropped onto fiber optics, which means that it can be retransmitted off of any tower in the state of Connecticut. So if we're moving resources from here to the shoreline, Groton Subbase, or from those areas to here, it really shouldn't matter in terms of radio communications. If the organization, the emergency response organization, is on the state radio network, which I suspect over the course of some years everybody's going to migrate to, there's no hiccups to communications whatsoever. Did that answer your question?
Yeah, it certainly did. And I just brought one more little teeny thing to mind, and that is the idea that because of this great coordination, I think it may be something that Congressman Courtney can utilize to actually promote the fact that we've got a great place at Electric Boat that's helping us with security internationally with the submarines, and also with the national security, because submarines are really based for national security as well in the coastal areas. And I just wondered if that kind of a thought is something that helps with his proposals in Congress.
I mean, I think that's probably above my pay grade to comment on, but I would say that, it's an all Connecticut effort. We're not that big of a state. If something's affecting the subbase, it's affecting all of us, and we all want to be part of that solution, and it's more true today that we are than ever before.
As somebody who's been a big advocate for regional approaches, statewide approaches, and taking full advantage of the technology that we have available to us, which is way, way, way above my pay grade. But I understand that it's that it's available, and at least I understand generally. It's very great to hear you say all that you said about this cooperation among different facilities in terms of getting things done in Connecticut. And I think you can set a good example for other situations and other institutions in Connecticut that I think should be working more closely together instead of, people talk about local control. Local control is an important factor, but we also have to work together with everybody, and that includes states working with other states. I mean, so it's very good to hear, Mark, what you're saying about this newfound interaction, technological interaction among all these service providers. That's great.
One of the things that I'm proud about is that when we signed the deal for this hybrid regional approach to technology for our two dispatch centers, Willimantic and Tolland, I challenged them to come up with a solution for mobile data terminals. In short, what we have today as a result is iPads in the front of all of our apparatus with a live map with little fire truck icons on it that are live, and that you can see where all the fire trucks are.
Wow.
And we have geofences around the firehouses so that when the fire truck breaks the geofence, the computer knows that the truck has left the firehouse. It timestamps it. It drops a geofence around the scene. It knows when you arrive on the scene. Times are very accurate. But that is a regional approach now. It's true of Willimantic and Mansfield and Yukon and Tolland and all these towns. In fact, Tolland even dispatches for Newtown, believe it or not.
Wow.
So they're on the system. And that system is duplicated out in Quinebaug Valley, and we haven't overcome the barrier yet, but eventually we'll bridge the two, and we'll all be on the same map and operating off because it's the same program. It's just they haven't been married yet.
Is the Tolland Center located on Route 195, on the east side of Route 195, as I think it used to be?
The town center?
The Tolland Center.
Oh, the Tolland Center.
Yeah. Just wondering.
I don't know how to describe, because I'm not super
okay.
familiar with
Tolland.
I
I was town attorney up there for a while too, and while I was there, I remember they got this building that they were able to renovate and use for the fire department.
We're probably
up there.
thinking one of the same.
It's a good sized building, and I thought.
Well, they have a training center up there. That might be what you're thinking.
No, that's
of.
the training center.
Yeah.
You're right.
Yeah.
I cannot let you go without asking you. You mentioned the ambulances. I'm so pleased that as part of our ARPA package that we had, we are purchasing, or we have purchased now, 2 new ambulances. As a senior citizen who may have to be, who may maybe have to carry it someday when I'm about 130.
Okay.
In one of those ambulances.
At 130, you're okay.
I am just so pleased that we've got that new equipment, and I think the town was very smart, very wise. The taxpayers came together at that big meeting. You probably were there. We put together that package. I was on the town council at the time, I thought it was very, very wise for us to purchase
That
those
was a real
ambulances.
splitting of the baby moment, wasn't
Yeah,
it?
yes, it
Because there
was.
was some
Yes,
tough,
it was.
tough decisions to
Oh
make.
yeah, there were a lot. There were a lot of people. There's a lot of needy and worthy recipients in this town, and so we made a decision, I think, on the town council, because we recommended it to I think town staff did as well. Jim Bolano for one. To make sure, we spent some money on local businesses as well, about $1 million, to also provide some equipment that we wouldn't otherwise be able to afford for the fire department in the form of those two ambulances.
We've had kind of this tension with ambulances related to their rapidly increasing costs in the last decade. Like everything else, fire trucks and ambulances are just going up exponentially in cost. It's scary how expensive they are today. And historically, we would, if we had our druthers, we'd buy a new ambulance every 3 years.
Sure.
We had two. Historically, we always had 2 ambulances in service. So a warranty on an ambulance is about 3 years. So we'd run it first due for the first 3 years of its life. We'd keep it for 3 more at the second due position. A little bit less volume. We run the devil out of them, and we're constantly putting tires and brakes and front end alignments and all those things on these things because we run them so hard.
They get a lot of use.
And we kind of were getting behind the 8 ball a little bit with purchasing ambulances. We were frustrated with the increasing costs. We toyed with this idea of doing what we call a remount. So we bought a used box that was in good shape, and we put it on a new cab and chassis. Honestly, it's been very buggy for us, and we haven't been really happy with the results. But it was an idea that we tried to see if we could control the costs a little bit. But we were getting behind the 8 ball. We went to Jim Rivers, town manager, and we said, we really would like you to carve out some money for not only 1 but 2 ambulances to allow us to reset back, and it has. Jim and the council were very gracious to allow us to do that. And we have, and by the way, now that we're doing Chaplain like we have for the last couple of years, that's a longer drive for our folks, more miles, but also more miles in the snow. If we ever get winter again, more miles in the snow in the bad weather. So we've transitioned now to 4-wheel drive ambulances. And so this ARPA money allowed us to. That's an added cost, right? It's a bigger chassis and cab. We went from a van style cab and chassis to a truck style cab and chassis. So this was the time to do it when we had the ARPA money available to us.
Well, everybody on the taxing district board, we have a lot of new people. I think the only holdover from the last year was Nick DeLise Martinez, who's the president, and I was on, but I took 2 years off. And a lot of us are very, very interested in having a tour. And we're looking forward to it, but we're going to wait until you get,
Please, it's a disaster.
Okay, I'm glad I learned about the disaster, but it's temporary, and you're going to get it fixed. And I'm just delighted. I want to see those ambulances.
As soon as the kitchen is fully finished, we'll get you down there then.
Okay, fantastic. Susan is raising her hand.
Very, very quickly, I just wanted to check in with you. I know that we have had the new fire school here now for a couple of years, so it's not so new anymore. But I just wanted to wonder how it's going with that, and we've been still talking because we had it finally finished during COVID, and we have never gotten together to have an event there. And I just was wondering what your take on something like that would be.
So real quick, like when we hire a new candidate, new employee, we send them to Windsor Locks, to the Connecticut Fire Academy for recruit school for 15 weeks. But when we do our OSHA required annual live fire training, we were having to look for places to do it before the school was renovated. Now it's in our backyard.
It's amazing.
We go right down there. We utilize it for training all the time.
Good.
We don't manage it. We don't operate it. We don't budget it. It's got its own board of directors and that sort of thing. So we're a customer like everybody else, even though it's in our turf. But we'll use the heck out of it. Can I say that on the radio? We'll use the heck out of it?
Yeah, I love that. And I'm very thrilled that you're using the heck out of it. And I do want to get together and have some type of an event just to highlight the fact that it's here. And it's the only fire school in all of Eastern Connecticut. And I'm just so proud. Senator Flexer and me and all the people who worked on it the 20 years before trying to get it here. And now it's all
State-of-the-art.
finished. It's fabulous. I'm just thrilled. So I just had to mention that.
You may not know this, but I was the attorney for the.
Oh, gee, I wonder.
I was the attorney for the
think I
fire
might
school
not
for
have known
several
that.
years, but not. But that was before. That was before we
Do you
all made
think-
the deal to
w-
buy the land.
We could just say, hey, it was a family event.
It was a family event, and when I went to the fire school for the first time, Dawn Niles invited us over there, and I remember going over there with Tom DeVivo and Randall Pros, and I was like, wow,
Yeah.
It's gorgeous.
compared to what they had before.
I said wow as well.
Yeah.
I said wow too, and we were all there at different times.
Okay.
All right,
All right, we're down to our last 10 seconds. Chief Scrivener, thank you so much for
It goes fast.
thank you so much for giving us the honor of your presence on Let's Talk About It. This has been a great show. We have to have you come back more frequently, and like I said, I'm looking forward to my first tour of the department once everything is in order. And thank you so much for being here.
Thank you
Yeah,
for having
thank you
me.
for your good work as well, and thanks to all the people who work here in this region. This is Susan Johnson with Dennis O'Brien and our special guest, Chief Scrivener. Thanks so much, and see you next week in a great new show.